Is Sunday, April the 26th, 2020. We come to you to give you an update on COVID-19 in Grayson County and what is actually going on. First of all, I would like to remind everyone to do their 2020 census. We'll probably say that every day at the beginning to make sure everyone reminds them to do that, and that only takes just a few minutes to do. 5 to 10 minutes you can have that thing done. So please, everyone, please remember to do that. It's very important. Next, remember National Day of Prayer on May the 7th at noon. Myself and Mayor Emery and Chester Schartzer and be a few more people here that we will go over National Day of Prayer, which is extremely important at this time. Next, I'm going to continue to say this, all road projects has been suspended through the state, and folks, it's just because, we're in uncertain times right now, so just be aware that there's a lot of things that's going to change with county and city governments as far as budgeting goes, and we don't know exactly where that's going to be just yet. So also food pantry, I've had a lot of people call and ask and want to know about the food pantry and places that they can donate. Folks, the best place is probably the food pantry right now. Please call Debbie Childress over there and get with her, because they had quite a few folks that they was actually feeding to begin with, but it has probably doubled or tripled now. Simply because a lot of people's out of work, and and I said yesterday there's been a lot of people that hasn't even received an unemployment check yet, which for 5-6 weeks it's been a little while. So do whatever you can for them. If you're wanting to donate, that'd be a great cause to donate to. Also, we've got a water main break, City of Litchfield. I've talked to Mayor Embry's here with us today, and Dwight Embry with Litchfield Utilities. And I'm going to let Dwight tell you a little bit more about what's going on, but they've had a main water line break, which everyone knows it's boiled water advisory, but I'm going to let him explain that to you a little bit. So Dwight Embry with Litchfield Utilities.
Good afternoon. Litchfield Utilities issued a boil water advisory at about 11 o'clock this morning. I was called about 8 o'clock this morning, and the water plant called and said they were losing pressure, so we dispatched the crews, and they discovered a 10-inch water line at the plant. It was the break was caused, it was construction related. We're building a new plant out there, and there was some ditch. Anyway, it was construction related. We had to shut down all of the water lines going into town until that 10-inch line was replaced. And so we lost a lot of water out of the towers. We lost a lot of pressure. Therefore, we needed to issue a boil water advisory. We did that around 11. We had the girls at the office, they called some of the facilities, the hospital and the old age homes and restaurants and things like that. We put a notice out on Facebook. This is no different than any other boil water advisory. Has nothing to do with the COVID-19 virus. We're taking samples now. The repairs have been made. We're pumping water back into Litchfield. We're starting to gain some water into the water tires. There have been several people with low pressure, some without water. We're hoping that your pressure starts coming up and that you start having water. The boiled water advisory, we're hoping will be lifted tomorrow. And that's all I have.
Any questions, Matt? Sam, anything come up? Nothing?
Thank you.
I could say something.
Go ahead, Rick.
I'll just say a word or two. It's times like this we appreciate the people who are representing us. Kevin's been on the radio every day, and he's been in the community every day. Josh Emery, Wayne Merriweather, and I hate to name names because I know I'll forget forget them, but we won't celebrate just yet. But I do see the light at the end of the tunnel. Maybe in a few weeks we can look back and really appreciate our nursing staff, our doctor staff, and just our city employees, utilities employees, county employees, and just we'll look back one of these days and really appreciate the good job that they've done, and appreciate the utilities and the issue they've run into today. Thank you.
Thank you, Mayor. Appreciate that. Also, I'll let everyone know on the water main break, I have also spoke with Kevin Shaw with Grayson County Water District, and as of right now, some folks that's out in the area of, and Dwight, tell me if I'm wrong, out in that area where the water plant is, Lewis School Road, I think some of those are directly through, are they through Grayson County Water District?
Some of the area by the water plant
Okay.
are their customers.
Okay, so some of those are under boil water advisories. Some of Grayson County Water District people are not under boil water advisories, and the reason is because they've got enough water in the tanks now, and they think it'll last probably 16 to 20 hours, and they might not even have to issue a boil water advisory until they fill the tanks back up, because Grayson County Water District does purchase some of their water through Litchfield Utilities. So just so everyone's aware, there's some folks that's got Grayson County Water District meters and stuff. You might not be under a boil water advisory right now. So is that good? Okay. All right. All right. Any questions with that, please just call, City Hall and talk to the mayor or talk to Dwight, and they'll be able to answer any of your questions. Okay, numbers. We'll go over numbers now. We knew it was going to be a bad weekend, folks. We knew it was going to happen. It's hopefully there. We've got light at the end of the tunnel. We hope so. But a lot of these, we've tested a lot of people, and but there's still a lot of people that hasn't been tested. Not necessarily at these facilities, but I'm talking in general in rural Kentucky. So just be aware, you probably will see a spike in numbers as testing becomes available, and Wayne Merriweather is going to talk a little bit more about that, and Josh will also. So today we have 12 new positives since press release yesterday. We've got 12 new positives. 26-year-old female, 72-year-old male, 41-year-old female, 76-year-old female, 84-year-old female, 94-year-old female, 80-year-old female, 77-year-old female, 86-year-old male, 86-year-old female, 84-year-old male, and a 65-year-old male. And to break these down a little bit, 10 of those are Grayson nursing and rehab residents. And understand, folks, it's not that they're doing anything wrong. They've done a blanket testing of their facility with all the residents, and so that's why they've got 10 more today. But be aware, I don't know exactly what the number is, but they've had a lot of negatives also. So they've had a lot of negatives, but I think, Josh, has everybody in that facility been tested now as far as the residents go? And they have been tested, and we're waiting on some of them to come back, but most of them has come back. But we have, because when I go over the pending number, you'll see the pending number has dropped dramatically. So they have got a lot of negatives over there too, folks. I mean, it's just they're not all positives. Just be aware, them folks are doing an outstanding job, and they continue to do it. And with the other 12, the other two employees, the other two are employees of Twin Lakes Regional Medical Center. And those folks are isolated at their residence. And Wayne's going to talk a little bit more about that, about the employees and how they're, how they're doing things and this and that. But everyone just please be aware, this thing is so contagious. And I mean, they're in the healthcare facility, they're in healthcare. Grayson Manor is, Twin Lakes is. Springview is. All these facilities that we mentioned, they're in healthcare. Of course, we know that it's going to end up there. We want to try to keep a handle on it as much as we can, and it's not any of the staff's fault or any of the residents' fault or anyone's fault for that matter. It's just something that we have to deal with, and they're dealing with it very well. So, hospitalized patient, 66-year-old male, hospitalized in stable but critical condition. 87-year-old female, resident of Grayson Manor, which is hospitalized in stable condition. 96-year-old male, resident of Grayson Manor, is also in stable condition, hospitalized, and a 56-year-old female hospitalized in stable condition. And so, some of them changes also, because I think the 56-year-old female was actually in critical condition yesterday, so some of that changes as well. But just continue to pray for those folks that's hospitalized, and continue to pray for the folks, pray for all of them, quite honestly, and remember everyone in your prayers. So next we have all Grayson Nursing and Rehab residents are in stable condition that are isolated inside the facility. Springview Nursing and Rehab resident, which there was one positive yesterday, is also stable condition and isolated inside the facility. Today's numbers, total tested so far is 373. Pending, we have 17, which that number has fallen. So negative, we've had 296, and positives total for today are 60. We're at 60 now, folks. So 4 of them is hospitalized, and 5 have recovered, and we've had 1 death. And Grayson Nursing and Rehab residents, as of right now, we have 33 residents at Grayson Manor that are positive, and 13 Grayson Nursing and Rehab employees that are positive, and 1 resident of Springview that is positive, and 2 employees of Twin Lakes Regional Medical Center that are positive. So with the numbers, I'll go over them again because I know some people come in late, so we'll go over those again. But like I said, folks, don't panic. Just don't panic over the numbers. I mean, it's tough to deal with, and you got a lot of loved ones over there in these facilities, and just don't panic. We'll get through this, and I'm going to turn it over to Wayne Merriweather right now. He's going to be with you because there's a lot of changes going on at the hospital. So Wayne Merriweather, Twin Lakes Regional Medical Center.
Thank you, Judge, and good afternoon, everyone. On March 18th, that's when elective procedures were stopped at the hospital, a little over 5 weeks. And I have to say that all of our world have been turned upside down since then. And that's certainly true at the hospital. This afternoon, what I want to do is talk to you about reopening the hospital. And not that we've been completely closed down, but we have been limited on the number and the amount and kind of procedures we've been able to do. That's going to be a phased-in approach over a 4-week period. It won't happen all at once. It'll be starting tomorrow, but it'll be phased in. I'm going to talk about those phases. I'm going to talk about some of the changes you'll see if you haven't been to the hospital in the last 5 or 6 weeks. And then I want to talk about expanded testing. So to begin with, on the phased-in approach, I'll say that this approach was developed by the Kentucky Department of Public Health in conjunction with the Kentucky Hospital Association, the KHA. The KHA represents hospitals all across the country, and they worked with the Department of Public Health to come up with this phased approach. The first phase, as I mentioned, will begin tomorrow, April 27th, and that phase will include the restart of diagnostic radiology laboratory services. I'll talk a little bit more about that in a minute. Phase 2 will be the first full week of May, or beginning May 4th. We'll be able to do outpatient procedures, those type of procedures that do not require an overnight stay. Then the next week will be phase 3, beginning May 11th. We will be resuming some of our elective procedures, those procedures that have been put off because they weren't emergent, such as knee and hip replacements, those procedures that require an overnight stay. And then the fourth week will be a full start back of all procedures, and that'll begin on May 18th. Now, I'm going to go into each one of those phases in a little bit more detail, beginning with the first phase. So tomorrow we'll see a resumption of non-emergent, emergent healthcare services and diagnostic radiology and lab services. Now, those will be in hospital outpatient settings, healthcare clinics and medical offices. Those are the ones that affect us at Twin Lakes. But also you'll see physical therapy, chiropractic offices, optometrists, and dental offices will be starting back tomorrow too. Now, let me just pause at this point and talk a little bit about the changes you'll see. If you've been to the hospital recently, you realize there's been limited visitation. Only visitors that are allowed to see a patient are those at the end of life, or if you have a minor that's a patient, an adult can be with them, or if a mother is delivering, then their spouse can be with them. Also, if you've been to the hospital recently, you'll remember that there's only two entrances, the main entrance and the emergency department entrance. And when you come in those entrances, you'll be screened. Your temperature will be checked, and you'll be asked if you have any COVID-19 symptoms. And that includes patients, visitors, and all employees. That's what we've been doing for the last several weeks, not only with visitors and patients, but also our employees. I get my temperature checked every morning, and I get questioned if I'm having any symptoms related to COVID-19. If that were the case with me, I wouldn't be, if I had a temperature or I had symptoms, I wouldn't be allowed to work. Here's what's new. We started last week asking everybody to wear a mask when they come to the hospital. That's going to be a requirement starting tomorrow. And I want to talk a little bit about that. Here's the requirement for wearing a mask. All healthcare providers, staff must wear a surgical or a procedural mask. That's what we have been wearing. That's what I wore as I entered this room, in this building. All patients and other persons in healthcare office and facility must wear a surgical mask or procedural mask while in an acute care hospital or ambulatory surgical center. In addition, you have to wear either a surgical procedural mask or a cloth mask covering in all other healthcare settings. Now let me explain what that means. If you're coming to see your physician at Twin Lakes, you'd be required to wear a cloth mask like this. This is one that was made by some member of our community. This is my personal mask. That's okay. Now, if you're going to another area of the hospital, in the lab, radiology, those kind of places, the emergency department, you'll be required to have a procedural mask on, a mask that looks like this. This particular mask will give you more protection than this. And if you come to the hospital and you don't have one of these, we will give you one. If you come to the hospital wearing a cloth mask and you're going to one of these areas that require you having this type of mask, we'll give you one. Now, I would encourage you, after you leave the facility, to keep that mask and to wear it whenever you're out in public. Now, I also wanted to talk a little bit about N95 masks. Probably everybody by now knows what these are. This is what's been in such short supply. It's really the gold standard of mask. It's an N95 because it filters out 95% of what you're breathing that might not want to breathe. Now, I will tell you that this mask cannot be used. It's been modified. It's a test mask. Everybody that wears an N95 mask is required to be fit tested. And if this hadn't been modified, they wouldn't let me out of the hospital with this mask. They're in such short supply and so important. And these are the masks that are worn when employees are taking care of a COVID-19 positive patient. Anytime they're in the room with them, they'll have a mask, an N95 mask on. Now, when you come to the emergency department, we'll make sure you have one of the surgical masks on. Something else you'll notice different when you come to the hospital are waiting spaces. They've all been modified to allow for social distancing. Seating will be 6 feet or greater, and we encourage you to abide by that anytime you're in any of our waiting spaces. That is phase 1. Phase 2. As I said, that will begin on May 4th. It will be procedures that don't require an overnight stay, such as a pain procedure, a scope procedure. And here's the requirements that we have to meet to be able to start those a week from tomorrow. We have to ensure that we have a 14-day supply of PPE, another healthcare acronym that everybody knows what it is now, personal protective equipment. And I can assure you that we do have that 14-day supply. Everybody that comes in for an outpatient procedure will be required to be tested for COVID-19, and that will have to come back negative. So many of you that have had procedures at the hospital in the past, you know, you come up for pre-admission testing. That will be part of that pre-admission testing and screening. And you will have to have a negative, we'll have to get those results back within 72 hours for you to be able to have the procedure. That shouldn't be a problem. Our turnaround time on testing now is anywhere from 24 to 48 hours. The third requirement, we have to maintain at least 30% bed capacity in both our intensive care area and on our patient floor in order to handle any COVID-19 surge. That should not be a problem unless we have quite a surge, more than we've had now. And then the fourth, each case will be reviewed by what's called our procedural priority and oversight committee. Okay, we've already had that committee set up for quite some time. They've been reviewing all of our emergent cases prior to them being done. Now they will review every case that'll be done as we open back up. Now I want to go back to testing just a minute and give you an example of how important this is for everybody that has a procedure. Judge Henderson mentioned that we've got 2 positive employees, and we do. And one of those was traced back to a particular patient that had emergency surgery. At the time, that patient wasn't known to be COVID-19 positive. We found out later, and you've heard about the health department doing tracing. They notified us that that patient was now positive. We had to do tracing back to every employee that had exposure to that patient. We can't confirm for sure that that employee was positive as a result of that exposure. It could have been from the outside, but that's a possibility. And this testing in the future will assure that that doesn't happen. So that's an important criteria for opening back up and one of the changes. Now, phase 3, beginning on May 11th, that will open it up to procedures that require an overnight stay, like a hip or knee replacement. Those normally require an overnight stay. Now, we can't start back at full capacity. We have to still meet all those other requirements, have the 14-day supply of PPE, have to be COVID-19 tested, have to maintain that surge capacity, and we'll only be able to do 50% of what we were doing before. Then if everything goes good during that week, we'll go to phase 4, the 4th week, May 18th, where we will resume all inpatient procedures that we were doing before and at those levels. And we still have to meet those other criteria. Next thing I want to talk about is the expanding testing. As you may recall, I mentioned it on here the last time I was here. Twin Lakes Regional Medical Center is one of the regional test sites that the Department of Public Health has established across the state of Kentucky. I think there's 42 of those now. We're one of them, and that's in conjunction with their contract with Gravity Diagnostics in Covington. And that's not the only lab we use, but that's the one we're using the most now. We just found out Friday that the state has increased their capacity with Gravity Diagnostics, and we'll be able to get up to 250 test kits a week, more if they're needed. In the past, there's been priorities that you had to meet. There's priority 1, 2, 3, and we could only test those in priorities 1 and 2. Priority 1 was hospitalized patients or healthcare workers that were showing symptoms. Priority 2 were those individuals with symptoms, patients over 60, and then high-risk individuals with symptoms and first responders. Now, here's what's new. We'll be able to start next week testing asymptomatic healthcare workers and first responders. Asymptomatic persons working or residing in areas that house a lot of people, long-term care facilities, jails, correctional facilities, and then individuals with mild symptoms in communities experiencing high COVID-19 hospitalizations. So quite an expansion of who we can test. You'll still need to call your primary care physician to get an order. They will call our staff that's working in the drive-through testing, and you'll be given an appointment to go and be tested. So let me finish up by just saying a couple of things about our 2 positive employees. With almost 500 employees, we had hoped that we wouldn't have any employees that are positive, but we knew that was probably wishful thinking. We feel fortunate that we haven't had any positive up until now. We continue to screen employees, like I said, every day, and they don't work if they have any of the COVID-19 symptoms. I will say that, we're supportive of all of our staff, especially these that are now positive. Like Kevin said, they are isolated at home, so we're thankful that their symptoms aren't any more serious than that, and we hope they don't escalate. Now, I want to say that for everybody that works in a hospital, a nursing home, EMS, on those ambulances, it's a tough time. It's really tough. 5 or 6 weeks ago, we weren't dealing with any of this, but we are now. And it's that unknown that's fearful, and we understand that. At Twin Lakes, we're supportive of one another. We're going to continue that. You'll see our employees in the next week or so starting to wear these T-shirts. We're Twin Lakes Regional Medical Center strong, TRLRMC strong. It's just a way of showing that we support one another and that we support our community, and we're there to take care of everybody in our community. So with that, Matt, Sam, do y'all have any questions?
Is there any plan on Twin Lakes offering antibody testing?
Not this time.
Can you repeat the question if there's still in here, please?
Sam asked if there was any plans to do antibiotic testing. hopefully we'll do that in the future. We just don't have that capability that's at this time. Anything else?
That was all the other questions from Facebook.
All right. Thank you.
Thank you, Wayne. A lot of information to take in, folks. So if you missed something, you always go back and watch it again, of course. But if you got another question, I can assure you, unless it's one of the hospital staff, if you ask the question on Facebook, you're not going to get a correct answer. So call the staff over at Twin Lakes Regional Medical Center, 270-259-9400, and ask for administration, and they will get you to someone that can answer those questions. Next, we have Josh with the Grayson County Health Department. He's going to give a little update here, and then I'll go back over the numbers again. I know some people, and there's been a lot of questions. We've been trying to watch the questions, and some of them sort of repetitive, but I've got some other things I want to talk about, and hopefully we'll wrap it up here shortly. But Josh Embry, Grayson County Health Department.
Thank you so much, Judge. All right, so today I'm just going to update you that, as I said yesterday, that there would be a call with Springview with the Kentucky Department for Public Health, and the Health Department was on the phone with that call. The Kentucky Department for Public Health basically went through a screening tool just to see how things are going in that facility, and overall our conclusion was that they're good on PPE and they're following the necessary protocols based on that screening tool. So I was glad that we were able to participate in that call. The next thing I'll say is just remember to keep Springview in your prayers along with Grayson Manor. The operations center at the health department still remains at level 1, and what that basically means is we are fully activated. We have nurses who've been in that DOC all weekend. I had one nurse who worked so many hours yesterday as the results were coming in, and so I would like to thank both Angie and Rebecca as well as all the nurses and staff at the health department for their contribution to helping us get through this crisis. The state had a record high. They reported a record high of positive cases this past Friday. It's around 322 cases, which indicate that we are edging near the peak of this virus. I'm hoping that there's a light at the end of the tunnel. However, there still may be several weeks of this to come. So everyone hang tight and try to follow social distancing measures to the best of your ability. At this time, I'm going to encourage everyone to take the following steps as we have advanced in the response to this virus. We've talked about wearing a mask in public. This has been recommended by the CDC. It is not a requirement, but it is highly recommended that as you go about your business at Walmart, gas stations, and in other areas, that you make use of a mask, whether it be cloth homemade or a more professional made mask. Again, this is recommended by the Center for Disease Control. If you become symptomatic, I'm going to encourage you today to contact your physician as soon as possible, report those symptoms, and set up testing. As previously stated in recent press releases, there are multiple ways in this county to get testing, from Twin Lakes Regional Medical Center's drive-through to fast-paced to possibly even testing in the doctor's office. We look forward to testing to continue to expand and have access. We know in places like Louisville and Owensboro they're doing drive-through testing, and we would like to see more of that here in the county as well. So we are working with the Kentucky Department for Public Health in advancing testing in any way that we can. All right, so the last thing I'll talk about is there was a question on yesterday's press release that I did not get time to get to, but I did today, and the question was, can you become can you get reinfected with COVID-19 after recovery? The CDC has released a statement that the possibility of this is unknown at this time. As previously stated, this virus is a newer virus, and there are still scientific studies that are being made to get answers to those very good questions. So hopefully we'll have an answer from the Center for Disease Control very soon for questions like that, very similar questions. Any questions for me? All right, thank you so much.
Thank you, Josh. A few questions that came up is some about what department that these two employees at Twin Lakes Regional Medical Center work, because people work different departments. Well, quite honestly, they've told those folks, anybody that's come in contact with them, they know that. So me and Wayne was just talking about it as the questions was coming in. So if you've come in contact with it, need not worry. They've done contacted whoever's been in contact with. The hospital and all these long-term health care facilities, they know what they're doing. They know who to contact, and the health department does. So people have been notified. All right, I hate to bring it up, but we're going to. We had a lot of questions about it. Walmart, here we go again. Talked with Walmart manager just a little while ago, and people's concerned about the square, how many people's in the store and this and that. Based on the square footage of the store and how many associates are inside the stores to determine how many people's inside the business, okay? And, of course, I said something yesterday about it, and then I had a couple people quick to criticize about I was wrong, and I didn't make myself very clear, evidently. So there is an executive order out for Walmart, and it's not just for Walmart. It's for any retail business that one person per household is inside that facility. So that pertains to them. So that's why they have someone standing outside, and they're counting folks coming in and out. And they are screening all associates. All their associates are being screened when they come to work. And whether they're taking their temperature, and they're all required to wear a mask, all their associates are. And they encourage the customers to wear a mask when they're inside the facility, but it's not required at this time. So, and the reason I'm bringing this back up again is there was a couple questions yesterday. A couple people was quick to call me out that I was wrong about something, and like I said, I might have not been clear, and I apologize because I'm not perfect and I make mistakes, and I'm going to make more, I can assure you. So, but one person per household on the governor's executive order inside the facility. So, they're still having issues with people being ugly. Today they had someone try to kick the door in on them, and folks, I can't even imagine what they're having to go through. I understand there's people not going by the guidelines, but folks, it is not their fault. It's not the associates' fault. I know a lot of people that work over in that facility, and quite honestly, I can't imagine all the nastiness that they're having to endure, and it's quite honestly, it's embarrassing. And because like we said, when we've said we're all in this together, we're all in this together. Nobody's getting any kind of special treatment here. So just be respectful of those folks. They're just doing exactly what they have to do to try to keep everybody safe. It's one of those places where a lot of people is going to be there because they're essential services. If something essential to you might not be essential to someone else, so, and then vice versa. So just be aware. But this is the thing, and I know a lot of people's got anxiety over it, and they just get tore up when they pass there and see the cars. My suggestion is, and I'm not trying to be judgmental of folks, but if it bothers you that much to go in there, don't go in. Go to another store. There's plenty of places you can go. We have the IGAs, the Dollar General stores, the Save-A-Lots. There's all kinds of places. There's places in Caneyville. I know there's a place down there, Deli's Market, that is actually selling groceries and stuff now, mass quantities of it. So go somewhere else, folks. If it bothers you that much, go somewhere else. And but them places has got to stay open. They're essential. That's what people are going to survive on. So, and be aware, the them folks, I'm sure if they would like to probably stay home and not be around this virus, but they got to go to work, and they've got to be in that. And so just be aware of some of your nasty comments when you go in there and try to knock down the door and everything else that, it's affecting those folks. They got feelings too. And so, remember them. I can't imagine what they're actually going through, along with the healthcare workers and everybody else. So let's see. Lakes, there was a question about lakes. The campgrounds are closed, Nolan and Rough River. Campgrounds are closed, playgrounds are closed, picnic shelters are closed, restrooms are closed. People said shut down the lakes. Folks, that's Army Corps of Engineer responsibility. A lot of these folks that's got lake property, they've got personal docks. They might launch their boat for the first of the year, and then they've got a personal dock. So don't look for the lakes to close down. I understand we have a large population that comes down here, but the same guidelines apply to them as applies to the rest of us that reside here year-round. And so just be mindful, that of the social distancing and that type of stuff, and please continue to call the hotline. We've got a lot of people that has called that, and they end up calling back down here and telling us. So other businesses open, we don't know, folks. We're just following the governor's guidelines. We don't know. We don't. You all know about the same time we know. So we don't know, and some of them, some of them, my opinion is some of them I might agree with, and some of them I disagree with. So but that's my personal opinion. But and some of them I don't understand, but it's what we need to do to try to protect everyone. And I know this is extremely contagious, so we need to watch what we're doing there. Somebody made a comment also about county government being closed down. Folks, county government, city government ain't ever closed. We're still open. Everybody's still in the building. The clerk's office, the PVA office, the county attorney's office, the sheriff's office, everybody, the jail, everybody is still working. As far as the tags go, you can do those online. I know some of you got like transfers, sold a vehicle or something. But just please call up and talk to Charlotte or any of the girls at the office. They'll be more than happy to help you and tell you, a way what they're doing to try to get everyone through this time. Because like I said, we're still open. You can call, but you just can't come into the building because there's no face-to-face contact with folks right now. So we went over that. Any questions? Anything, Sam? You got anything? Nothing? Matt? Yeah. Hold on just a second, folks. Wayne wants to make one more comment here. Hold on.
One thing that I should have stated that I didn't, if anybody needs to come to the emergency department for services, the emergency room, don't be afraid to do that. Across the country, we've seen volume drop in all emergency departments. And we've seen that same thing here. Our volume has been cut in about half. And I think it's because people are afraid to come to the hospital. Now, you shouldn't be. As I was talking earlier, when you come, all of our staff will be in a mask. Each person coming to the hospital will be put in a mask, and you'll be screened. So it's very safe. Now, the reason I say that is because there's been cases across the country where people have not come to the hospital when they've had symptoms of heart attack and they've been having heart attacks at home and dying. And we don't want that to happen in our community. So don't hesitate. If you're having issues that require emergency room services, please come. Don't put it off. It could cost you your life, and we certainly don't want that to happen. All right, thank you. That's all I had to.
All right, thank you, Wayne. Once again, I told you I'd go back over the numbers with you, and we have 12 new positives today on April 26th, Sunday, April 26th. We've got 12 and 10 of those are residents of Grayson Nursing and Rehab, and 2 are employees of Twin Lakes Regional Medical Center. And that brings our total to positives to 60 here in Grayson County. So just remember those folks over there. And like I said, this is nothing. We're not shocked. I mean, I know some of you all are probably shocked. We're not shocked. We knew this was going to happen. Grayson Nursing and Rehab knew it was going to happen because, you know, they blanket tested those residents over there. So, and like I said, remember those folks. They're up, 20 hours a day. You know, some of these nurses are nurses and the CNAs and not in the janitorial staff. I mean, usually it goes down the line. I mean, they're all there. Just remember them. Remember the Springview. Remember, Beehive. I have a great aunt out at Beehive, and got family in Grayson Nursing and Rehab, and you start going down the line. Everybody does. So that's why I say, folks, if I had the answer to this, I'm telling you, I'd have done called somebody and told. That's our only chance. That's our only hope. And like I said, for the most part, 99.9% of the folks in the community is doing great, and hope everybody continues to do that. But that's why we hold these briefings, to put out information of questions and complaints and all that type stuff that we have out of every one of our facilities. So that's why we try to put this stuff out to you all. And we're not trying to be mean or not trying to be downers. We're just trying to keep you informed, because, I know a lot of people sort of try to analyze the numbers, and folks don't, because they change every hour. So just be aware that they do. Might go out. Sam just informed me the mic went out, so is that one good? All right. Have you got any questions, Sam? I'm about to wrap up. Any questions on there that you need to ask? Nothing? Matt, you got one?
I've got one. Are there any updates on plans to blanket test Springview residents?
I think they're working on it. Josh?
You want me to speak, or?
Yeah.
I'll just tell you, yes, there are plans. They have some numbers in mind, and if they hit that benchmark, then they're gonna work with the state on testing more people.
Okay, Matt's question from the News Gazette was, is there any plans to blanket test Springview? And that was the meeting today, correct, Josh? Yes. They had a meeting today with Michael and the staff over there, and if they meet, they've got one right now, so if they have a certain threshold that they meet of positives, that the state has recommended that they do blanket tests. So we'll just wait and see exactly, where that goes. We'll, see what Springview decides to do on that. But, like I said, remember them folks. They're under tremendous amount of stress, all these long-term care facilities, and, everyone in the community right now. So just remember each other. Everybody remember each other. So any questions? Wayne, you got anything else? Josh, you got anything else? Any questions, gentlemen? All right. Thank you all. Thank you for tuning in. I'm sorry it took so long, but there's a lot of information to get out there. We'll probably come to you again tomorrow, because a lot of things are changing. But remember to stay Grayson County strong. We will get through this, folks. We're going to. So let's and just remember, pray the Lord will heal us, and everyone, God bless.